And in addition, women with this mutated gene also have a 40% chance of having breast cancer. So the results that I got from Dr. Fernandez, it really confirmed and it reflected my family's history of so many premature deaths due to these cancers. But there was hope in spite of all this gloom and doom. Lots of hope. The genetics testing gave us an opportunity that people who had gone before us did not have. Because now that we knew what was causing these cancers, we could choose to prevent both cancers by having preventative surgeries, gastrectomies, and mastectomies. So just 5 years after I had approached the genetics, after I had made that first call, more than 50 relatives have had the surgery that has saved their lives, because indeed they did have early stages of this deadly cancer. And many have chosen to have to avoid breast cancer as well. And many of our family, our extended family across Canada and in the United States, have also benefited by the knowledge that was gained here in Newfoundland. You might say that a genetics research anywhere could have found this, but I beg to differ. Branches of my family, some of whom were themselves physicians, who knew and had shared the family history with a number of major health centers in the United States, were never examined for the possibility of this mutation. We are not only a small place here, but we're also a very relatively small gene pool, with the majority of us coming from a few counties in England and Ireland. And this provides a very unique and a very important opportunity to study many mutations, as Dr. Fernandez has just said. The genetics department has not only helped many families, but they have also made significant contributions to the scientific community and contributions that are acknowledged worldwide. If we lose people like Dr. Fernandez and others, many of whom are from this place, we cannot hope to provide the medical care and the research that we need. We are highly unlikely to replace them. We are indeed a small and out-of-the-way place. The international community will know the circumstances under which we lost the expertise we had. And thirdly, as stated before, people like Dr. Fernandez are not a dime a dozen. There are so few people across this country who have the expertise that she has. And people, I think, ought to really reflect on that. I don't know how we got to this stage, but I do know it would be a great misfortune, even tragic, if in this province we cannot solve this. Thank you.
So I think this, thanks so much, Patricia, and thanks for agreeing to speak so publicly about your disease. I think probably we should just take questions now, if there are any.
What will it take to change your mind for you to stay here? Our government is still coming back saying that they're not willing to increase the offer that they have on the table.
No, so I think from my own perspective, I would like to see something that we're able to offer a salary package that is somewhat competitive with other Canadian provinces, so that people, see, apart from myself and Leslie Turner, there are very few other Newfoundlanders that have ever gone into medical genetics. So basically, when we're offering a position, we're expecting a resident in another province that has no ties to Newfoundland to look at not just the remuneration, but also the work environment, and make a decision as to whether or not this job is a good job to consider as one's first job in the career. And so I'm hoping that after all this is over, we'll be able to do that.
And Have you received job offers from other parts of the country? I know some doctors have.
Yeah, so I was in this situation where I was trained in Toronto, and about a year ago there was a very nice position that they were asking me to seriously consider in Toronto, and at that stage I told them I really was very committed to Newfoundland. And you have to understand, from my perspective, I've built up so much expertise with understanding the diseases of Newfoundland, and I have, in addition to my clinical work, I've researched projects that have taken 5 and 6 years to sort of collect patient samples and things. So I really, all things being equal, I would much rather work in Newfoundland than in any other Canadian centre. So at that stage I said no to Toronto, and when they heard what was happening, I was recontacted asking me, had I changed my position on that. And then I guess some of this has been, in the Globe and Mail, and then I did receive an offer from Ottawa where they're looking for a medical director. And I mean, at some point, I'm going to have to make some serious I'll have to go to these centers, do interviews, negotiate a contract with another hospital. And once I think a person goes so far down that road, you can't really turn back, in fairness to the institution that's putting together a package. So yes, there are places I can go to work, and so but I haven't actually negotiated a definite contract anywhere, because I am hopeful that there will be a resolution.
I'm curious, what attracted you to Newfoundland in the first place? You were trained in Toronto.
Yeah.
So, why this problem?
Why would I come here? So I was raised in Newfoundland. So I lived here since my parents moved here when I was 5. I went all up through the school system here, and I went to medical school here. And then I left to do the genetics training because it's not possible to train in genetics in Newfoundland. And that's actually one of the things that makes it hard for us to recruit, because we don't train. We don't get access to those residents from within our own center. But anyway, and then I went to Toronto, and actually Dr. Elizabeth Ives was the person who established the service in 1986. She was planning to retire, and she contacted me when I was partway through my training just to see if I would be interested in committing to a position here in Newfoundland. And I did. And when I made the commitment, there was actually supposed to be another geneticist here, but by the time I got back to Newfoundland in 1999, well, Dr. Ives had retired, as was planned, but the other geneticist had decided to leave. So actually the service had gone down to no geneticists, and it had been run by locums for about a year. So it was not an easy position to come back to, and I think had I not had domestic ties to Newfoundland, I never would have come. But then, time went by, things got better. Dr. Turner joined me as a colleague. We were able to grow the service. And I think, how I decided to participate in the action taken by the group of 14 is that I do believe in my heart we can't do anything more with the genetic service than we're doing now without recruiting more geneticists. And I just kind of wanted to say, because there's been sort of sometimes implications that, the quality of the care is not good, or nothing could be further from the truth. The patients that get in to be assessed in my service, and I think in all the other services represented by the resigned physicians, the assessments are good. They compete with any assessment you get in Toronto or out west. The problem is the wait list. And our wait list, we had managed it reasonably well up until a year ago, because we had a pool of locum geneticists that we used to bring through every summer. When I rang round to try to get those same people to come back this year, 2 of them were over the age of 70, including Dr. Ives herself, and both said to me, look, we're not practicing medicine anymore. So then we were down to kind of like one person, and Dr. Ferreira did agree to come, but the locum rate is tied into our compensation package, and the locum rates here are not very competitive. So the type of people that have come for locums have always been semi-retired people, where the wage wasn't as important. It was more just keeping their hand in the practice of genetics, and they gave us wonderful service, but we're kind of running out of those people now. So the wait list in genetics now for the non-urgent assessments is 2 to 3 years, and I just feel it's too long.
Fernandez or Dr. Connors, are you hoping that the government might be more open to your demands, or should be more open to your demands, given that there's a surplus now in the budget, that the financial update given by the province yesterday is now forecasting a $12 million surplus instead of a $200 million deficit?
Yeah, I did hear all this, and from my perspective, I feel that in a way, no, it's not completely irrelevant, but what we would like to see is the government coming forward with a fair compensation package. And I understand that if there is absolutely no extra money in the Treasury, that's not going to be possible. But I think how much money that's in the provincial coffers, in a way, is a little bit irrelevant. What we're asking for is a fair, competitive remuneration package so that we can fill chronically empty positions, stabilize the workforce, get those wait times down to things that are comparable to other Canadian centres.
Does it not somehow strengthen your opposition to the government's offer, knowing that there is money in the coffers?
Well, yes, I suppose that is true, that if there was just absolutely no money and they had to run a deficit in order to sort out the doctor's problems, it might not be reasonable to ask them to do so. Yeah.